This is a serious and diffuse threat to our whole society, and yet most of us aren't going to die. So focus on not passing it on. By distancing and isolating early, you help not only your neighbours and vulnerable members of your own family, you help the health service deal with an insane demand for intensive care. China has faced this sort of serious threat many times before, and so we're better prepared. Things are going to get worse, and maybe much worse before they get better. Despite rumours to the contrary, we are still a democracy and not a police state. So the speed and the security of our recovery depends on us as citizens not allowing the state to take the whole responsibility on our behalf. Good habits are hard to acquire, bad ones are hard to get rid of. Before this epidemic, I had no idea how to wash my hands in such a way as to prevent the spread of disease. So go online, find a video, there's tons of them there, and just check that you're actually doing it the right way. Public anger drives unwarranted anxiety in countless others who are already doing their very best to stop the virus. Needless anxiety burns the energy and the resources we will all need if and when the virus comes to us. Social media networks like Facebook make their money from getting people to share human emotions with each other, which then spread exactly like a virus. Rather, use social media purposely, either to share stories or to get help. Get your facts from professionals and your opinions from experts. If you already know who some of the most vulnerable are, then please get in touch and offer whatever help or support you can safely provide. We can, and I think we will, do better as this crisis goes on. In the UK, work should kick in that will allow us to connect on a much larger scale to see if they're okay and to find out what they need. Collaboration is improving testing so that we may soon know not just who has the virus at the point of testing, but who has had the virus at some point in the past. It may also bring us a vaccine in the medium to long term. Sharing positive as well as negative data and stories gives us a much rounder picture. COVID-19 may be nasty, but as far as we know, it's not airborne. The air at the moment is much cleaner and clearer than normal, so open up your windows. Eat as well as you can, drink lots of water. Experts say that's about 2 litres a day, which is far more than most of us are used to. And if you can, cut your alcohol intake. Have a routine. It will help your spirits. And if you have a sunny room somewhere in your flat or in your house, do spend some time in there for the vitamin D. On your daily exercise, enjoy the peace and the bird song.